everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Ketorolac. Its brand name is Toradol. Before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Ketorolac is a non-steroidal anti-inflammatory drug that blocks prostaglandin complex formation as well as production. It is a potent analgesic that does not possess any sedative or anxiolytic activities. In terms of indications for use, Ketorolac is indicated to be used in the treatment of short-term pain. It can be used to treat pain in the eye following a refractive keratoplasty. It can be used in some inflammatory disorders of the eye. And finally, it's indicated to be used in seasonal allergic conjunctivitis. Now, before somebody was to use Ketorolac or Toradol, there are some contraindications they must clear, as well as some precautions and warnings that they should be made aware of. Ketorolac would be contraindicated in patients who have had an allergic type reaction, asthma, or urticaria in response to exposure to aspirin or other NSAIDs. It would be contraindicated in patients who have a suspected or confirmed increased bleeding risk. It's contraindicated to be used as perioperative treatment surrounding a CABG or coronary artery bypass graft surgery. If somebody has suspected or confirmed cerebrovascular bleeding, they would also not be able to use Ketorolac. It should not be used with aspirin or other NSAIDs. Patients with a recent history of gastrointestinal bleeding or perforation should not use Ketorolac. It's contraindicated to be used during labor or delivery in pregnancy. This is because of an increased risk of uterine hemorrhage, and there's a risk of it adversely affecting fetal circulation. Nursing mothers should not use Ketorolac, as there may be an increased risk of adverse effects in neonates. If somebody has an active or a history of peptic ulcers, they cannot use Ketorolac. And finally, it would be contraindicated in advanced renal impairment or in patients with a risk of renal failure due to volume depletion. Now, in terms of precautions, cerebrovascular thrombotic events, including myocardial infarctions and strokes, have occurred in patients using Ketorolac, whether they had pre-existing cardiovascular disease or no disease at all. Gastrointestinal side effects such as ulceration or bleeding may occur and could be fatal. Higher doses would increase the risk of serious adverse reactions. Patients under 110 pounds or 50 kilograms would also be at an increased risk of adverse reactions. Duration of use of Ketorolac, whether it's used alone or in combination with other medications, should not exceed 5 days. Ketorolac is on the Beers criteria, which is a list of medications that the elderly population should either avoid or use cautiously. In this population, we would be concerned about acute kidney injury or the increased risk of gastrointestinal bleeds. Patients with pre-existing asthma may notice a change in their symptoms. Patients with heart failure who use Ketorolac may put themselves at an increased risk of experiencing a myocardial infarction or a heart attack. They would also be at an increased risk of experiencing a hospitalization due to their heart failure. There is an increased risk of new onset or a possible worsening of hypertension. Hyperkalemia or high potassium levels may occur in patients using Ketorolac. There would be an increased risk of exacerbating symptoms of inflammatory bowel disease, whether that be ulcerative colitis or Crohn's, in patients who are using Ketorolac. Skin reactions, including fatal cases, may occur with the use of Ketorolac. Examples of this would be exfoliative dermatitis, Stevens-Johnson syndrome, and toxic epidermal necrolysis. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start using Ketorolac, they can receive their dose intravenously, intramuscularly, or through a tablet. For these following examples, I'm just going to use dosing regimens for each dosage form that would be used in treating short-term pain. All of this dosing also only applies to patients between the ages of 17 and 65 years of age. They may receive 30 milligrams intravenously just for one dose, or they could receive this 30 milligram dose every 6 hours. Maximum dose per day would be 120 milligrams daily, and they could only do this for a maximum of 5 days. 60 milligrams intramuscularly as a single dose would be appropriate, or 30 milligrams intramuscularly every 6 hours would also be appropriate. Again, the max dose would be 120 milligrams per day, and again, maximum 5 days. For the oral tablets, it would be 20 milligrams for one dose, and then 10 milligrams every 4 to 6 hours. The max dose in this situation would be 40 milligrams each day, divided up throughout the day. And again, the same rules would apply in terms of duration for 5 days. As with all medications, there are some side effects or adverse reactions that patients may experience while using Ketorolac, so I'll list some of those here now. Edema and hypertension can happen between 1 and 10% of the time. Between 1 and 10% of patients may experience pain at the injection site. Up to 10% again may experience itchiness or rash. Abdominal pain, constipation, diarrhea, and flatulence, again between 1 and 10% of the time. Nausea would happen greater than 10% of the time. Dizziness and somnolence would happen about 10% of the time, and headache would be greater than 10%. Some more rare but serious side effects would be a gastrointestinal hemorrhage, gastrointestinal ulcer, cerebrovascular accident, hearing loss, or one of those dermatological side effects such as Stevens-Johnson syndrome. That's all we're going to talk about today with Ketorolac or Toradol. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.